Good morning and welcome to today's Insight AppSad webinar series. I would like to begin by acknowledging the traditional owners and custodians of land on which this event takes place and pay my respects to elders past and present. I'm coming to you today from Meanjin, or Brisbane, on the lands of the Turrbal and Yagara people. I'd also like to extend that acknowledgement to any Aboriginal and Torres Strait Islander peoples who are joining us today across the web. My name is Sam Belmano and I'm a nurse educator here at Insight. I have the pleasure of facilitating today's webinar on understanding preloading, a new theory of alcohol and drug use before events. Our presenter today is Dr. Jacob Sorbello. Dr. Jacob is a clinical psychologist and researcher, fellow with the University of Queensland. We'll have some time for questions at the end of Jacob's presentation. So please, if you have any questions, put them into the chat and we'll ask on your behalf at the end. But with that, welcome Jacob, and over to you.
Thank you, Sam, and thank you to Insight for hosting me at this webinar. It's a fantastic opportunity to talk about preloading and some of the research that I completed at Griffith University. So a little bit about me today. So yes, I'm a research fellow at the University of Queensland. I work for the Meaningful Outcomes in Substance Use Research and the National Centre for Youth Substance Use Research. I'm also a clinical psychologist. I work in private practice, and some of the clinical interests and research interests are listed on this slide. I thought before we get started in looking at preloading, first it might be a little bit fun just have a bit of trivia with the audience about what you might already know about preloading. So preloading in general is drinking or using a substance before going out and drinking and using more substances. So first question, historically, how far back do you think preloading dates back to? I'll just give the audience some time, just have a little bit of a think. So there's actually accounts of the Romans preloading before going to the Colosseum. So in essence, it's quite an ancient behavior, but it's become more pronounced, I guess, in the 2000s to 2010s. Who do you think preloads more? Men, women, or is it about the same? Now, based on our research, it's about the same. So men and women seem to preload at pretty much the same rate. So there's not really any difference between the genders. So next is, do you think everybody preloads? So if generally people are going out for a night, do you think everyone would preload? True or false? Now the answer is false. So different research has looked across different regions, and the rates of preloading are between 60 to 90%, and we've seen that in some of our studies as well. How old do you think the oldest person was where we sampled? So we did field research, sampling the general population with Griffith University and the Queensland Police. So we sampled people across young people, adults, and also older adults. So the oldest person we sampled was 82 years old, and they're going out night clubbing. And lastly, what do you think is the main reason for why people preload? Now, I think a lot of people might suggest here that it's to save money, and certainly you'd be right in the Australian context, but it really depends on the culture. It depends on the region that research is conducted, and also the time and place, as we'll see a bit later. But just generally speaking, here's some of the main reasons for why people preload. And this research was taken from between 2017 to 2019, but we'll see that it actually changes over time. So before I get started in this webinar, I also want to thank my collaborators that I worked alongside at Griffith University and also with the Queensland Police. So thank you to them. So in today's webinar, we've got 4 aims. So the first is I'm going to introduce preloading behaviours. And what you'll get out of this webinar is that you'll find that preloading is a nuanced alcohol and drug consuming behavior. That's different to general alcohol and drug consuming behaviors. The next is that we want to outline motivations, consumptions, and harm trends of preloading. That way you can identify risky patterns of motivations and then also provide strategies to help prioritize harm minimization if you're noticing some of your clients or people that you're doing research with are engaged in preloading. Next, I'll introduce a new theory for preloading that I've written with one of my collaborators. And by the end of this webinar, you'll have a clinical and research formulation for investigating preloading. And lastly, this is if we get time today, I'll discuss two other types of loading behaviors called side and backloading. And again, I think this would be really helpful to identify and reduce harm for side and backloading behaviors. So that's our aims and hopefully what we'll get through today. So first, let's touch on preloading. So if we're to define preloading, it's the use of a substance before a specified event or target event. Now, the preloading is a term used in the research literature, just in Australia and New Zealand, but it also varies and depends across different regions. So in Europe and in Australia as well, it can be known as pre-drinking. Sometimes in America, it's known as pre-partying, America and Europe, but also in New Zealand and the US, it's also known as pre-gaming. Sometimes people will just simply call it pre's as well. The thing to take in mind with preloading is that there's often a plan to consume and continue substance use later on in the evening as well. And this earlier intoxication is associated with later night harm. So that includes heavier binge drinking across the night out, but it can also be greater involvement of assaults, risky sexual encounters, and also people blacking out because of excess intoxication. In order for us to understand preloading and the other loading behaviors, I think it's helpful to contextualize it with a kind of example. So imagine that a night out is kind of like a night out of the theater. So we're getting ready to go to the theater. In the early evening, we have the preloading event that's taking place before we actually go to see the show. Next, we have the target event. So this is, typically the event that people are planning to go to. So that can be going out to dinner. It can be going to a football game. It can be going to a pub, bar, club, or a party. Sometimes there's multiple events that people go to. And in between the event, they might go through and have a bit of an intermission. So it's kind of like going between the two parts of the show. And that is known as sideloading. So continuing to use substances in between going to target events. As we'll see later on as well, sometimes people also engage in drinking and substance use after going out, after the target event. So after the show, they might go back home or to another person's place, and this is known as backloading. But we'll have a look at this, this contextual example later on as we look at side and backloading. Okay, so why are we so concerned about preloading? Well, when we compare people who preload to those who don't, people who preload are 4 times more likely to consume excess of 20 standard units of alcohol. They're also 2.5 times more likely to be involved in assault, 2 times more likely to experience sexual assault. And we also know that preloading is associated with vulnerability. So people who have, some researchers found that people who have PTSD symptoms are more likely to preload and then be exposed to more consequences and more vulnerability. We also know that preloading is associated with earlier patterns of binge drinking, which then increases scores longitudinally as well. So some research has examined the longitudinal effect of preloading. We also can see that preloading had some concern in research across the 2000s. So in the late 2000s, there was a lot of policy changes. So a lot of places around the world were reducing drink specials. So you might remember the 2-for-1s or happy hour specials. Sometimes they still exist in different cultures, but places like Australia removed those, and some places in the UK also changed those policies. And so this pushed people to start drinking at home and to try and save money and also have somewhere where they can drink and socialize and increase intoxication in a fast and safe route. Throughout the 2010s, there was a lot of scrutiny in Australia around preloading and crime that was occurring in the nightlife districts. And a lot of research was and policy was designed to try and reduce preloading. In 2015 to 2016, we saw the introduction of lockout laws in Queensland. And so this was One, trying to curb alcohol-related violence, but also trying to reduce preloading by making the night out more scarce, so that people would come into town earlier and also finish up the night earlier. I'll talk a little bit more about lockout laws and the effect to preloading a bit later. But as well, we also saw the introduction of ID scanners, and that was trying to make the safe night out precinct safer as well. So my research came along in 2016, and I was really curious about why do people preload beyond common reasons like saving money and socializing, and as well, what do their motivations predict in terms of how they consume alcohol or substances. And so my research conducted a lot of field and survey research, and today I present a bit of a summary of the findings. So the first, in terms of looking at the field research, we sampled around 4,500 people in my studies alone. And as I said before, it ranged from people who are 70 and 82 years old. Found very consistent results that around 60 and 90% of people preload before a night out. On average, younger people preload, but you can see there's no differences between men and women. So 75% men preload as well as 76% of women preload. In terms of consumption rates, men typically seem to drink on average more than women. So it's almost 2 standard drinks more on average. But if we look at intoxication rates, men aren't significantly more intoxicated than women. So there's not a large deal of difference there. And the reference point for intoxication is blood alcohol concentrations. And 0.05 is the usual reference point we'd use for people in the field. Of note, when we're looking at preloading, consumption tends to be higher on average than the recommended NHMRC guidelines for trying to reduce alcohol-related harms with binge drinking. So before people even start their night out, they're exceeding those binge drinking guidelines, and that's a point of concern for sure. When we look at party drug use at preloading, the main 2 drugs that people often use are MDMA and cocaine. So this is taken from my colleagues' studies, and it's closely followed by cannabis. This might change as well. So this was some research sample back in 2015 to 2016. So we might see changes in drug use as well as changes in drug markets. When we look at the reasons why people preload, we can see that these often change across time as well. So when we first started the research back in 2014 to 2015, the main reason that people reported for preloading was actually to socialize, followed closely by saving money. Later on, once there were some changes and introductions in some of the policy in Queensland with the lockout laws, we actually saw that the motivations for people seemed to change. So saving money became a stronger motivation over socializing. We also saw a larger percentage of people that were reporting wanting to get as drunk as possible as one of the main reasons for preloading. And we'll touch on that motivation in particular shortly. When we look at the reasons or the motivations for that are related to harms experienced in a night out, there's 2 motivations that particularly are common for people experiencing harm. So we asked people what type of harm they've experienced in their past across a 12-month period, and we related this to the motivations for preloading. So the 2 that are most concerned, if you're looking for in your clients, people who are reporting preloading motivations to get as drunk as possible. So that is, in effect, an enhancement type of motivation. So people are trying to maximize the levels of intoxication because they really enjoy that feeling of feeling intoxicated. As well, people who are reporting feeling as comfortable as possible. So when people want to experience, a good night out, sometimes they might feel anxious, they might feel stressed, and they also might be struggling with the entertainment district, and that can be loud and boisterous and very have an unsafe feeling there. But our research has found that often these 2 motivations are associated with being assaulted in the entertainment districts, experiences of risky sexual encounters, blacking out, And the get as drunk as possible motivation was associated with higher audit scores. So a lot more alcohol-related problems were associated with that motivation. Interestingly as well, people who reported saving money motivations reported higher occurrences of blacking out in the entertainment district. So that means that people who were trying to save money actually ended up experiencing the harm of drinking a bit too much in the entertainment district. So there have been some interventions that have tried to reduce preloading. However, to date, some of these interventions have not been particularly successful. So the first was a motivational interviewing intervention for people that were mandated to reduce their preloading in US college student samples. So this was unsuccessful. It didn't seem to reduce the frequency and consumption of preloading. There's also been 2 online interventions that tried to target motivations and decisions to preload, which have met with mixed success. So Peterson and colleagues in number 4 there had developed an online brief education specific content to help people to reduce their preloading. It seemed to have a minor effect in reducing the amount of times that people preloaded, but it didn't reduce their consumption trends and rates. We've also seen policy interventions that have been attempted to try and reduce preloading. This has found nil effect. So this is the lockout laws I was referring to, as well as my colleague Devley and others found that actually increased preloading rates and intoxication. And their argument for that was that when we reduce the time available for people to go out, it makes that time more scarce and people start to value preloading more because they have less time in the entertainment districts. So it's an interesting effect that when we try to restrict the amount of time that people have for going out, that it can actually increase and create a greater value for preloading. One thing I considered towards the end of my research was, do we actually have a conceptual understanding of preloading? There's a lot of talk about wanting to reduce preloading, but we're not too sure yet around why people do preload and how we can shape those interventions with a really strong formulation or theory. So that's what myself and my colleague did. We argued for creating a new theory. First, we need to understand why preloading is difficult to conceptualize with the current models we have. So the first model that was looked at with preloading was the motivational model of alcohol use. Some people might be familiar with this model, but essentially it's fairly simple to understand. People drink or use substances because they want to change the way they feel, and that's the mechanism. It's called affect change. So for an example, if I feel sad right now, if I have a drink, then I'll feel better right now. And it's a really powerful mechanism that we can see in our clients. Okay, so immediately we can change the way we feel just by having a drink of alcohol or using a substance that has a really quick route of administration. But the challenge with preloading is it doesn't really explain why do people drink and use substances later. So the model doesn't really fit preloading. So what my colleague and I did was we created a new theory that changed this mechanism to affect management. And it looks something like this. At the preloading event, people will think they will feel a certain way at that target event, so just before they're going to go out. I think I'll feel a little bit bored, or I think I'll feel a little bit unsafe. So I use a substance so that I can feel better later. So this tweak just helps us just to understand and conceptualize why people might use substances now, because they're predicting that they might feel a certain way later on. And I think there's some interesting clinical work we can do with clients when we're thinking about how they use substances in preparation for certain events. So here's what the theory looks like. It might look a bit complicated, but I'll walk you through the theory. The three tenets of the theory here are that distal and environmental factors can help shape cognitive and motivational factors for preloading. These cognitive and motivational factors will then influence one's decision to preload. And there's 4 possible decisions we'll touch on. And these are based on the perceived reinforcers and punishers around preloading and going out to drink. Most importantly, we argued that people experience certain consequences from their night out, which will then reinforce and shape the next time that they preload. So this can be in positive or negative directions. So we'll go through these factors really quickly. So the first, distal factors. Most models of alcohol use or any substances consider that some people have different biological individual differences to the way that they perceive and use substances. So some people are just wired to be attracted to the rewarding effects of substances. But we can also see that there's a socio-cultural trend with preloading as well. So a lot of college parties in the US really function to reinforce preloading. In Australia, we have a cultural trend around preloading as well, where people seem to enjoy it almost more than actually going out to the event. When we consider the distal factors, we also want to consider where and when people are planning their preloading, and then also what is around them when they are preloading. So we look at stimuli and triggering cues. So something that might increase the rate of intoxication is certain peers and the availability of substances, as well as different contextual trends that are going on at preloading. So for example, a lot of people can use the preloading event as a way of getting ready for the night out. So these contextual and immediate factors will then shape what people learn about preloading, which is the next factor we'll look at. Cognitive factors. So we look at 5 different things for how people make plans for preloading. So this includes where, who they're with, how much time they spend in preloading, their choice of substances, and then how much it's going to cost them to offset that substance, that use of substances compared to when they're going out. And that's really important because people often expect that preloading is going to be strategic and cost effective. We can also see that though sometimes people will engage in preloading unplanned, so sometimes they'll be influenced by friends to come out and to go out with the night out. So when we look at the expectations, I already spoke about the strategic cost effectiveness, but people also preload because they want to feel safe when they're going out into noisy environments. They also might feel socially anxious when they're going out. But lastly as well, preloading is also expected to be fun and enjoyable. And sometimes people report that they often feel it's much more fun and enjoyable than the actual party or night out clubbing. Generally speaking, sometimes people might also say that they won't feel like they'll enjoy the night out if they're not a little bit intoxicated. So these expectations then shape the motivations for why people engage in preloading. It might push people towards a desirable experience, but also draw them away from an undesirable experience. One that I'd highlight specific around drug preloading is that sometimes people will also use substances because they're afraid of the apprehension of taking substances into a party or a nightclub. So for example, people might use MDMA or other substances that have a longer route of administration before they go out to avoid the risk of detection. So these factors then shape the decisions that people can make. So essentially, people can make 4 different decisions: to preload with alcohol, to preload with drugs only, to preload with alcohol and drugs, or to not engage in preloading. And this generally works on how people perceive these certain benefits and risks of preloading. So for example, if someone has to drive the next day, they might not take substances. But if it also conflicts with their morals and values, they're less likely not to take any alcohol or drugs. Lastly, we look at the consequences that reinforce preloading. So something that might reinforce preloading is people actually have an enjoyable night out when they're feeling that the preloading session helped them to get ready for the night. We also might see that being involved in assault, as we saw from some of the research that I presented earlier, can actually increase preloading as well. So people want to get more drunk so they don't feel so unsafe in the target event. There's also long-term consequences that might reinforce people's preloading, such as feeling accepted in a peer group. But something that might discourage people from preloading excessively next time is if they face significant consequences from substance poisoning. So these consequences, we can actually help people to reduce and to mitigate so they're not reinforcing their preloading in the next next event as well. And I'll touch on questions that can help you to identify ways to reduce harm there. So just as a summary there, we looked at the distal factors that shape preloading. Cognitive and motivational factors will then push people into making decisions around their preloading, and then consequences can then reinforce the next preloading event. We argue that preloading is all about how people want to manage their affect or the way they feel before a target event. And you can use this theory for both a research and clinical formulation. So in terms of how we can use the theory in practice, so we can ask people certain questions that use the tenets of the theory. So we might just first ask someone, okay, have you preloaded when you've gone out? Who do you preload with? So we want to understand how they plan and contextualize their preloading, where they preload. Sometimes it can be at someone's place, can be on the way to going into the target event. We also want to understand how long people spend in the preloading session, because that then informs how rapidly they might consume alcohol or drugs, or how they might plan out that event as well. You can also ask people, how much did you plan to consume versus how much did you consume when you weren't planning that? And if there was any party drugs while they were consuming as well, or while they were preloading. We also want to understand what some of the reasons for why they preload, particularly keeping an eye out if they're preloading, if they're reporting that they want to get as drunk as possible, or that they're struggling with their sense of self and anxiety before going out to the entertainment districts. And lastly, we want to check in on some of the consequences that they have experienced from preloading. So if they've experienced a fight or an assault, or a time they couldn't remember during the target event, we really want to talk with them, trying to help them to reduce that risk for their next preloading session. With harm minimization, we have to consider how we can help people to reduce the risk during preloading, because it does predict how much they're drinking later on in the evening as well. There's no safe motivations for preloading. So even though people who socialize for preloading, it's not associated with reduced alcohol consumption, but we can prioritize group safety. We want to steer people away from the emotive reasons for preloading. So we want people to focus on the social event and catching up with friends and driving and helping them to take their focus away from intoxication or using substances. Feasibly, we can help people to try and reduce their drinking below 4 standard drinks. It is tricky because the evidence often shows us that people don't count how much they drink. It's not a very helpful protective behavioural strategy, because sometimes people really struggle once they get past a certain threshold with counting their drinks. But we can help them to try and slow the intoxication rate down by some of these harm minimization strategies you're probably really familiar with, such as drinking water-treated drinks, having food present, and having a designated person that can also look after their friends. Probably what's really crucial with polysubstance use is explaining to people the interactions between party drugs and alcohol. So sometimes people might use both alcohol and cocaine, for example, and then they're not familiar that alcohol can actually dull the effects of cocaine, and then they reinforce each other. So while we don't want to encourage substance use or recreational substance use, we just want to explain that those substances often don't mix well together, and that a way to minimize harm is to choose one substance over the other. Okay, we should have time to go through sideloading and backloading. So as a refresher, sideloading is the intermission between the target event. So people are stepping out of the club, or they're going from a party, so a nightclub, or going between, let's say, the Brisbane city and the casino, and then going out to the valley. So in between that, someone might engage in keeping intoxication going by getting some alcohol or using substances in between going between the venues. This is often done under some sort of stealth. It can often be done, particularly in Australia, because we have laws against consuming alcohol in the street, often illegally as well. Sometimes people, because we've got ID scanners as well, they might hide alcohol or substances in pockets and consume it while they're waiting in the line. So obviously that means there's different cultural differences in sideloading. Some places around the world that allow alcoholic drinks in the street. This would probably be more prevalent. Somewhere in Australia, it might be less prevalent just due to the legal ramifications. Some of my survey research, we asked people about sideloading, and we looked at some of the motivations for why people do sideload. So interestingly, there's not a huge difference between the genders, but women often reported a little bit more sideloading than men. Although when we asked people how much they consumed, the males have reported on average a bit more. But again, this is very exploratory statistics. The main reason for why people sideloaded was generally because they want to save money, followed by keeping that intoxication going. So sideloading is all about trying to just top up the current level of intoxication people are feeling. And again, similar to preloading, the main party drugs people used while sideloading was MDMA and cocaine, though not as much as in preloading, it should be noted. So when we're trying to talk to people about sideloading, we're asking this very similar questions to preloading. So have you sideloaded before? Do you do it alone or with others? We want to know where people sideload, particularly if they're, for example, using something like cocaine in the bathroom. Because this will help us shape harm minimization efforts, helping people to have a safer spot if they are going to sideload, and just to letting them know the risks of contamination if they're using substances in undesirable places. We also want to know the reasons for sideloading, again, steering people away from emotive reasons. When we're talking about reducing the harm for sideloading, it's less about how much time people spend in sideloading, but more about the opportunity that presents itself. So sometimes people will often just use one substance when they're sideloading. Set and setting is also really important. Unplanned substance use is often associated with increased intoxication as well as consequences. So you would want to talk to your clients about making sure they have a plan if they are going to use substances, and also not accepting substances from people randomly that they might meet around target events. As well, we want to, in terms of harm minimization, want to let our clients know about the legal issues around consuming alcohol or party drugs in the street. As well, some people might not be familiar that if they're possessing or supplying party drugs, particularly in Queensland, that they can face pretty severe consequences if they're apprehended by the police. So sometimes these harm minimization strategies can help people just to be a bit more mindful around sideloading and thereby not increase their risk and intoxication levels. Okay, we're going pretty well for time. So let's move on to discussing about backloading. So as a reminder, we've finished up at the theatre for the night. Some people might have engaged in sideloading, not everyone does, but we want to spend some time just to wind down. Some people might choose to go back to somebody's place. They might go back to their own place and invite a few friends along. So this is known as backloading. It's at the end of the night. So it's consuming alcohol or other substances after leaving a licensed premises, and often it's in a domestic dwelling. Colloquially speaking, some people often refer this as the after party or kick-ons or having a nightcap. In the research, it can also be known as end loading or backloading. Now, it's a particular concern for clinicians because backloading can be associated with further intoxication and also further harm as well. So some of these statistics are again taken from a survey sample that I completed during my studies at Griffith. Interestingly, it kind of swaps between males and females. So more males reported that they'd sideloaded before backloaded compared to females. And when we also asked people in the field if they intended to go to a kick-on or to backload during the night out, more males reported that they were more likely to do that as well. terms of backloading consumption, males reported a higher level of drinking than females, which was consistent when we look at preloading as well. And some of the main reasons for why people want to backload include they just want to keep that party going if, let's say, the club closed early. But also some people see it as a chance to wind down the night. So they might not be ready to finish up the night. So they're looking to wind it down and just have a slower sort of recap of the night. We don't have any data yet on some of the substances that people might use at backloading. But yeah, that would be interesting research to do in the future as well. So again, similar questions we might ask when we ask people about preloading and backloading. We want to know who they did it with, where they do it, if it's for someone else with someone else's place or going into a hotel room as well. So sometimes people have reported that they go back to the hotel room to continue drinking or someone else's. We want to also know if people are consuming more alcohol or if they're planning to use party drugs when they're backloading. And then also why they backload as well. Again, steering people away from emotive reasons for backloading. In terms of harm minimization, we can consider that backloading is right at the end of the night. So we're really particularly concerned about what's going to happen the next day for when people are deciding to finish up the evening. So if people are continuing to use alcohol or substances right into the early hours in the morning, we want to encourage them to take safe forms of transport when they're going back home to their home. So we can tell them to, okay, make sure you take public transport or you take a ride share and avoid drink or drug driving, particularly because some clients might not be aware that substances can stay in their system for some time after they've used it. Safety is a really big priority with backloading. Some people did report that they backloaded to hook up with someone or to keep the party going. So they might be putting themselves in vulnerable situations. So we can encourage that if someone is reporting regular backloading, that they look at going with a friend or someone that they trust and to discourage them from going alone. We also want to encourage them to if they're considering backloading, to be in familiar environments. Set and setting is really important. So if people haven't used any substances in a particular setting before, we want to carefully tell them that it can really influence certain harms like overdosing, particularly if they've used a lot of substances across the night out. A lot of people reported backloading because they were looking to wind down the evening. So we want to be mindful of telling people around some of the effects of substances that can be really important to not overdo certain substances, and that they can use the opportunity to slow down the levels of intoxication. Can be helpful with preloading to set limits as well. So maybe only setting an hour or two to go to the backloading event or the kick-ons, and then looking to go home safely as well. And also, as with preloading, take food to a backloading event, have food ready so that people can absorb some of the alcohol that they're that they've consumed as well. And that they're focusing less on the effects of the substance and more about just winding down and socializing. Okay, so I guess, considering some of the implications of the research we've found, I think the research is still looking at developing individual strategies that can help manage intoxication. But alcohol and drug professionals are really good at helping develop individual strategies. So when you're working with clients, you want to help them to manage, to help them to reduce the levels of intoxication that they are experiencing across the night out, and also to steer them away from emotive reasons for pre-side or backloading. We can encourage groups as well to take turns in their nights out. So if they have a group that they're going out with, one person might have the designated sober friend night, and then they look after the group and make sure that the other people are not sort of getting into as much trouble. We have to be mindful, though, that some people do preload, sideload, backload on their own. Okay, So they might not have some of the group safety suggestions that we might work with there. Policy has also influenced the way that people do preload as well. For example, if you've walked around in the valley on a Saturday night, you can see that there's often really long lines to getting into the venue. So often people might say that they want to preload more to get in there. So we do have to consider at the policy level that sometimes the interventions that are often designed to keep people safe can often drive up intoxication and desires to get more drunk or use substances. There's often the cost of living is really challenging as well at the moment. So, helping clients to be able to try and save money during their night out might be really important. So that might be looking at sharing rideshare apps or taking public transport. Lots of people don't want to go into nightclubs and bars early because there's often not much going on. But that's probably more of a discussion for government and policy to consider how they can entice people back into nightclubs earlier and then to not have so late nights. There's some interesting social and cultural trends happening that a lot of people are probably familiar with. So globally, there's some statistics that young people's engagement with alcohol use is actually declining. But I think there needs to be further work on looking at young people's participation in drug use earlier on as well. So we want to keep a mindful eye if some of our clients are using substances when they're preloading in particular. When we're aiming for a broader cultural change, we can consider how we can challenge people's beliefs about the benefit of preloading. So interestingly, Queensland Health put out a marketing ad recently looking at challenging these beliefs around preloading and considering whether it's a really good idea to use or drink a lot of alcohol before going out. So this is actively using some of the theory and also challenging the expectations around preloading. Particularly, we want to alter the reinforcement narrative of preloading so that people often save a lot more money when they're going out. Often people don't. Some of the research my colleagues have found is that people often might spend a bit more when they preload because they've lost their rational or reasoning abilities there. But there's something to consider there around particularly early education, intervention in schools and colleges, where there's more work that needs to be done around preloading to help kids to make the informed decisions and not be swayed so much around the social aspects of preloading and also some of the emotive reasons for using preloading. And the last thing to consider is that the research does know a lot more about preloading than we do about side and backloading. So there's more work that needs to be done around understanding side and backloading, because side and backloading and as well the experiences that people have in the target event might also then reinforce further preloading sessions later on over people's experiences. So that's an interesting space for future research to develop as well. Well, we're going pretty good for timing there. Here's some of the conclusions and summaries. So we've looked at preloading, and we've also looked at two other loading behaviors known as side and backloading. We conceptualize these as a night out in the theatre. So the preloading session is all about getting ready before the show. Then there's the target event, which is the show at the theatre. And then we looked at side loading as being an intermission between the two parts of the show. And then that sometimes people want to keep the feeling of the enjoyment of the show going by backloading and having more substances at the end of the night. So the most common party drugs that people consume at pre and side loading are MDMA and cocaine. So we want to keep a mindful eye on those and the interactions between alcohol use. Most men and women exceed the 4 standard drinks, recommended 4 standard drinks of reducing alcohol-related harms at preloading. And particularly harm minimization efforts probably could be helpful to try and reduce that number so that people aren't priming themselves for further risk across the night out. We've also looked at the theory of preloading and used it to have conversations with clients around their preloading, because in essence, we talk a lot to clients about their alcohol and drug use in general, and look at it across a given time, such as a week or a fortnight. But when we're looking at preloading, we're kind of zooming into a particular night and trying to understand how that pattern of substance use varies across in terms of their general substance use. In terms of harmonization, we are aiming to manage and reduce levels of intoxication. We're aiming to shift people away from emotive reasons for preloading, and we want to promote safety within the group or individually. As with other substance harmonization efforts, we're aiming to reduce polysubstance interactions and then aiming to reduce the reinforcement effect of preloading from the consequences that people experience from a night out. So that takes us to the end of the webinar. I thank you all for listening, and hope that's been an interesting look into preloading. I'll hand it back to Sam now for questions, if any audience have questions.
Thank you very much, Jacob. We have got a few questions here, so and we've got some time, so we'll go through them. First question is a bit of a two-parter. For the groups who are seeking to get as drunk as possible for their motivation, was there any identified increase in polypharmacy use?
That's a good question. We don't have the data for that at the moment, because we've looked at alcohol and drugs separately. Though I think some of my colleague published on drug preloading back in 2023, and I do remember that the get as drunk or get as high as possible motivation was associated with increased alcohol intoxication, and I think increased substance use as well. But I would suspect that it would be associated with polysubstance use, particularly if we're considering substances like cocaine. Cocaine and alcohol seem to reinforce increased use, but I'm not too sure just yet on the data for that at the moment.
No worries. And the other part of the question is probably going to be the similar type of answer, which was for those who use the motivation of saving money, was there like a decreased inhibition, something that led to more polypharmacy use while they were out? But as you said, it might not be something you looked for in the research.
Yeah, no, an interesting one, I think, when I was, so we looked at preloading motivations across a night out. So we took 3 different time points across a night out. And these are different people that we sampled at 3 different points in a night. And often people who reported saving money motivations were often less associated with intending to backload later on. So some of the interpretation I found from that was that people who report saving money motivations are often a little bit more frugal. So they might not necessarily engage in polysubstance use as much compared to some of their peers who might want to drink or get as high as possible. But then we might find, particularly because there's that research was taken from prior to COVID, we might see differences now as cost of living challenges impact people. And that people might find that using substances might be more affordable than going out and drinking all night as well. So yeah, there's certainly, I guess, that we could get some more data and update some of those questions around polysubstance use.
There was just another question. It might not have been for the research you did specifically, but when you're mentioning about the lockout laws having an increase in preloading, did we also see a significant increase in backloading when the lockout laws were introduced?
Yeah, that's a good question. We don't know the answer to that. When you can have a look at that study, it's by Devley, Kavanagh, and Hydes back in 2017. But yeah, that study was mainly looking at a 1-year difference between the lockout laws. So they took a snapshot of preloading rates in 2016 and then a snapshot in 2017 and looked at the differences between preloading intoxication and preloading rates between those two, but they didn't ask about backloading. So it would be a really curious question if it did increase backloading rates as well. And hence why I did put some of the suggestions around future research in side and backloading. We don't actually know a whole lot about it. It's only quite a new concept that was being talked about almost 10 years ago, but not much research has been done on those two types of loading behaviors.
There was just two more questions, and then just a few people who just said thank you. But there was one question about was a person's drinking behaviors looked at, such as were someone who's drinking daily, were they identified as engaging in preloading, and were there any increased harms?
Short answer would be no, in terms of the research we've conducted in the field, particularly. When we were talking to people in the field, we often had a very limited amount of time to engage with people. But I think there's been some other research that has looked at general drinking, how much people spend generally drinking versus preloading drinking as well. Yeah, the challenging thing, I think, a lot of times with preloading and in general is that it's often focused on younger people, and the concern is that younger people are developing this pattern of binge drinking, which might translate later into general higher alcohol use across their lifespan as well. But no, our research didn't look generally at general drinking days in the studies that were reported. So apologies, I can't answer that question.
No. So sorry for the questions that I'm getting the answers. We did have one question, which just kind of looking at when talking to a client, you identified that a lot of people were saying that they didn't feel like they could have an enjoyable time when they went out without drinking, without being intoxicated. Do you think that it would be a effective route to identify this with the client and look for other activities that doesn't involve intoxication as a way of reducing their involvement in preloading?
Yeah, it's definitely a very common reason for why people report wanting to preload. Is if they're going out sober into a nightclub or a party, they just don't feel as comfortable. They don't feel like they'll be in the mood, or they'll have enough of a buzz to enjoy the evening out. So yeah, I think it's a really great suggestion, actually, that if you're working with a client and they want to still enjoy a night out sober, that they can focus on other aspects of the evening. So for example, if they're going to a music gig, you could talk to them about, okay, is there other aspects of that event that you can enjoy, such as the music or talking and meeting new people, or going to a different venue that might be more enjoyable, such as like an arcade or something like that, or enjoying aspects around the entertainment districts, like the food. Is there some good food that you might enjoy? Because it's challenging. Some of our clients particularly might be looking to, they might be in a recovery space, so they actually don't want to drink or use substances, but they still want to go out and enjoy time with their friends. We can be really creative in that space and help our clients to focus on different aspects of the night out, rather than having to feel that pressure that they need to consume substances before a night out to enjoy that. I hope that answers that.
No. It was one of our participants' questions, so I'm sure it answered it for them. It definitely answered it for me when I was interpreting that question. So thank you very much. We have a lot of people who are just saying thank you for presenting today. A few people are specifically just sharing stories about now being non-drinkers, and but previously when having a lot of binge drinking behavior, definitely identifying with a lot of the behavior you're discussing in the session, and that there's a brilliant session today, and increasing their understanding with some of the choices and things that they were doing. That's kind of combining a few of the different participants, but generally, thank you very much for today. It was very, very interesting for me personally, and I'm sure that every participant also found it quite interesting. So thank you, Jacob, for